Chairman Deaver, Vice Chair Campos, other esteemed members of this committee, thank you for allowing me to testify this afternoon. My name is Noah Torres. I'm a policy scholar at the Texas Public Policy Foundation, and I'm testifying on HB 4408, which would bring greater transparency, accountability, and oversight by creating reporting requirements relating to healthcare entity ownership and control. Not to recreate the wheel, but as we've already heard, that healthcare entity consolidation and concentration is going up, very steadily increasing. So fewer and larger firms are dominating markets, and those markets are being dominated by a smaller number of players. To illustrate how much that has changed, in 1990, only 65% of U.S. healthcare markets were concentrated, whereas in 2016, 90% of those markets are concentrated. In Texas, in 2018, 90% of markets were concentrated. By 2020, 95% were concentrated, and 61% of Texans live in areas that are rated as highly concentrated per DOJ scales. And what's worth noting is that 20 major metropolitan areas in the state are considered highly concentrated. So the material change transactions that lead to consolidation and concentration are often elusive to state and federal oversight. And just to this point, in a 2024 study by the National Bureau of Economic Research, of 2,000 exempt mergers in the dialysis industry, of 4,000 mergers in total, every single one led to quantifiably higher levels of market concentration, and patients experienced worse health outcomes. For example, 5% higher hospitalization chance, 3% decrease in survival rate, and nearly a 10% decrease in the likelihood that they would receive a kidney transplant. Research across the board indicates that consolidation, concentration lowers competition, and the absence of that competition or the decrease in competition harms patient health.